Hello, ma'am. I am J. Vincent Arpon, and I will be your PT for today, ma'am. So for now, ma'am, what we will do is I am going to be asking to you a few questions regarding about yourself and about your condition, ma'am, so that I will know how to treat you and I will know about the background of your case or what you are feeling right now, ma'am. So please bear with me, ma'am. I will now be asking you a few questions, ma'am. So okay, na, ma'am. Okay. So may I ask you for your name, ma'am? Okay. May I ask you for your age? Okay, ma'am. Where do you live, ma'am? Okay. Just for clarificatory purposes, is that on gender, ma'am? Okay, thank you. What is your nationality? Okay. What's your civil status, ma'am? Are you married, single, or divorced? Okay. What's your occupation, ma'am? Sa trabaho? Okay. What's your religion, ma'am? What's your dominant hand, ma'am? Is it left or right? Okay. So who is your do you know who is your referring medical doctor, ma'am? Okay. When was that, ma'am? How about your physiatrist, ma'am? And when was the consultation? Okay. So do you happen to know, ma'am, your medical diagnosis? Okay. So have you been taking any medications, ma'am, from your previous yung mga checkups? Okay. Okay, ma'am, thank you. So do you have any other clinical tests na gihatag nimo, gipabuhat nimo? Okay. Sige, ma'am. So what made you come here today, ma'am? What is your concern? Okay. So let me clarify lang, ma'am. You told me that you feel a painful, burning, and aching feeling in your lower legs. Then mo radiate siya going upwards. Sige, ma'am. If I were to let you rate the pain from 0 to 10, 0 being the lowest and 10 being the highest, how would you rate it, ma'am? Okay, 8 over 10. Okay. So again, ma'am, as what you told me, you experienced wood falling and then a certain change in your voice. Okay. So with your left nga upper limb, ma'am, kaya you feel loss of sensation. Sakto, ma'am. Okay. Then you feel pod nga medyo mugahit, no? Yung left upper extremity. So you also told me, ma'am, nga you sometimes lose balance and you have difficulty walking, especially with bending your left leg, ma'am. No? Okay. And you also told me, ma'am, you have difficulty with your daily activities, like walking and dressing, eating, and personal hygiene. Okay. So, ma'am, can you tell me before na manifest ni imong kanang imong complaint, what were the things that happened before that led to this condition? Okay, so May 4, you started to experience those symptoms, but nawala na siya, ma'am, after 2 weeks. Okay, then August 8, the symptoms arrived again and you went to the hospital, you had your MRI, and got diagnosed ka, ma'am, with relapsing remitting multiple sclerosis. And you were also given with medications. Okay, then September 2017, you were referred for PT, ma'am, no? Okay, so December 2017 to March 2020, nawala na sa imuhang nawala sa imuhang manifestations. Okay, so April 2020, so nibalik na po because of COVID, ma'am, no? Nibalik because nakastasa ko visit. Okay. So March 5, you were referred, then March 6, you're starting na sa ato ang PT session. Okay. So have you had any history of hospitalizations, no, or surgery? So no hospitalization for the last 5 years, but you had 9 times, no, history of falls in the last 3 years. So I will be asking for you, ma'am, a few questions about certain disorders, diseases, ma'am, and tell me if naaba ka ani or imuhang mother or father naaba niya na diseases, ma'am. Okay. Hypertension, ma'am. Okay, your father. Diabetes, none, ma'am. Okay. Cancer, ma'am. Okay, none. How about asthma? Okay, so you have asthma and you have sinusitis, ma'am, father. Okay. How about any heart conditions? None, ma'am. Okay, ma'am. How about arthritis? None, ma'am. Okay, thank you, ma'am. So any allergies, ma'am? Do you have any allergies as to food, drugs, or any materials? So none, ma'am. Okay, ma'am.
So now we're going to talk about your living situation. So who do you usually stay with at home? Okay. So how many floors are there? Okay. So is this a residence area? Okay. So this is a dead end. So ma'am, how many houses are there within the perimeter and their distance from each other? Okay. So is there a single step elevation on the porch towards the entrance? Okay. So how many steps would it take to the living room from the entrance? So from the first floor guest bathroom, so how many steps would it take to reach the base of the staircase towards the second floor? Okay. So from the second floor, so how many steps would it take to reach your son's bedroom? Okay. So how many steps would it take to your room or the master suite? Okay. So what do you usually do at home? So are there any safety bars? Okay. So is there any cupboard in your kitchen or the overhead cabinets? Okay. So ma'am, let's talk about your lifestyle. So what did you usually do before you were diagnosed with multiple sclerosis? Okay. So what do you drink beer occasionally? So how about, do you smoke? Okay, good. So do you okay, you relapsed to music. Okay, good. So ma'am, so based on the while interacting with the patient is ambulatory using non-skid standard walker, mesomorphic, wears eyeglasses, there's a trunk leaning, intention tremors during movement, and no unusual body breath odors and alcohol odors and smell. So patient is alert and oriented. Time 3 person place time as to conscious, coherent, cooperative. Patient is fair as to verbal. So there's a learning barrier as patient wears eyeglasses and has difficulty reading without them. Patient is a visual and audio learner. So patient's concentration and attention span is good. And patient presents with a clean appearance, is wearing a white lace dress with excessive makeup, prefers long hair done throughout the examination, only allows female therapists to do her examination, initially hesitant to build rapport with the therapist until son was allowed to enter the examination room, seldomly avoids eye contact with the therapist and turns to her son, does ordinary recital yet stops on her own accord, and very conscious of her intonation and pronunciation, became relaxed and a little bit engaged after being asked about her home situation and body condition. Anxious since she changes her sitting position, and fixes her dress. So demeanor is not threatening and no unusual body or alcohol smell. So memory and perceptual is both unimpaired.
Good afternoon, sir. So I am Faima and I'll be taking your vital signs. So I'll be taking your BP. So sir, do you know your baseline BP or what is your BP before? 110 kilos. Okay, sir, can I ask mo sa your hat? So, what we take on the LWT, there's other mga hat, there's like where was it? Okay, sir. Okay, sir, and you see what I what is this? This is how I will who's next? Who's next? Where you put it? Ha? Tingnan mo yung who's next. Right here. Okay, so next up. So three was it is going to pass this on either very is inside. Next assessment is your chest expansion measurement. So we have three levels. First, okay, level of your left is all about you. Get up on it. Yeah, see it. See it. Is like this. And here is it. Next step. Now you here. So next step. One, you go here. Okay, see it. Is like this. And you next. And it's on line. Next step is repeat. Is like this. And it's next one you do it. So it's okay. Okay, this understand. Next is last number 3 second box is okay. You know, so like this is together. This time you do it. Okay, that is 98 cm. So the patient presents significant difference of 2 cm, meaning that there is an increased chest expansion. So our next assessment is auscultation. So I'll be touching your seat. So here I am in one hand. So wait, now you go next. So upon auscultation, there was a heart murmur noted and an ambiguous red sound for long auscultation. So for the next assessment, I'll be doing your independent assessment. So first, I'll be taking your some touches and skins. So first, check the skin temperature. So next is so upon conviction, patient presents normothermic outer body. The skin consistency for her is also normal outer body. So lymph nodes are also normal. So finally, your last assessment with me is your spasticity. So we will check how what's the guide what's the skin. Okay, so this is your modified skin. See, like how So upon doing your spasticity test or modified Likert scale test, patient presents hypertonicity on bilateral upper and lower extremity, and there is a grade 1 plus spasticity on bilateral upper and lower Okay, ganun. Ito lang. Labas. Patient presented positive for process, delivered positive yan. So here we have the cardiac resistance. So there's like that's for your sense of smell. Okay, so presenting that. So this is bigger, Rosula. This is and this is okay. So now I want you to close your eyes and identify the cells under the okay? Okay. So this is this one. Okay, this one. This one. This one. This one. Okay, very good. So the patient is able to identify both the restrictions. So next I will be checking for your pupil like this one. So I will check. Look at me. I will check right here. Okay, very good. So the patient's pupils will straight up like as light is shown to them. Next, so I should look at my finger. Yeah, so look at this. Okay, balik down. So may mga tayo yung mga head. Okay, and head yung mga okay, so patient's eyes are able to move in all directions because so check the light shown to them. However, patient's eyes are not able to move downward and laterally at once. So I will be next I will be doing facial expressions and your presentation. Okay, so I want you to say yes. Okay, yes, yes, yes. So the patient was able to identify the stimulus presented in the face. Okay, so yes, so facial expressions. I want you to touch it. Okay, now I want you to open your eyes. So the patient was able to clench her teeth and yeah, close your eyes when the cotton bud was placed on her. So next would be I would like to check your facial expressions. So first I will close your eyes. Close your hard, close smile. Okay. Now I want you to smile. Smile big. Open your eyes. Open your eyes, not smile. Big. Smile big. 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 Okay, very good. Now I want you to blow. Okay, very good. So next would be I will check for your hearing, but this would use the right or reverse test, but I don't not have much network, so I will probably be using the whisper voices. Okay. So I want you to repeat what I'm saying. Okay. Other side. Okay, very good. So the patient was able to hear equally in both ears and heard louder at the external auditory like. So next, I want you to swallow. Okay, tulong na. Okay, tulong. Contact ka. So the patient was able to contract, but is not able to swallow. Okay, now I want you to say okay, okay, very good. The patient was able to say want to swallow again? Okay, so the patient was able to swallow, but is able to contract the throat. Next, okay, so I want you to sit here. I want you to sit here. Okay. I want you to shrug your shoulders. Okay, next, shrug it. Okay, very good. Okay, now I want to, okay, do it again, and let me push it down, okay? Let me push it down. Okay, very good. So now, okay. Hold your tongue, okay? So now, the other tongue. The other tongue. Left, right, up, down. Okay, very good. So the patient was able to remove her tongue.
So the patient's height is 170.1 centimeter. Patient's weight is 50 kilograms, and the BMI is 19.0, which is normal.
For the gross body symmetry, patient presents with tongue leaning towards the right side. Now we will check for the gross range of motion. So I want you to reach your right hand to your left hand across your back. Okay, so she cannot reach it, so it's up there. This side. She also cannot reach it, so it's up there. Then we'll do it in the lower leg, so lower shin. So now I want you to raise, slide your shin. Slide your heel to your shin. Okay, slide your heel to your shin and then to your knee. So this, okay, other side. Okay, very good. Now we will check for your gross muscle strength in your perspective. So I want you to pull my hand. Okay, try to pull my hand. Okay, so she's not able to pull my hand. Okay, she's not able to pull my hand. Okay, so now for the lower limb. So I want you to raise your here. Okay, I want you to pull it, ha? Pull it. Okay, pull. Okay, so she's not able to pull it. Her gross lower extremity muscle strength is impaired. No, so we'll do it like this. So, here, boss. Other side. So this side is normal, right side is normal, and left side is. So the left side is there is a considerable limitation on the left side and shoulder, and also there is a slight limitation on the elbow. Also to the wrist and hand. There's also a slight limitation. The hand. Okay, so we'll go over to the side. Next would be the hip. So let's go to the right side first, right side. Right side. Okay, so for the other side. So there is a considerable limitation in the left side and a slight limitation. Okay, so the knee. So now for the knee. So on the right side, it's the left side. So on the left side there is a slight limitation also on the left side knee.
knee, and then for the ankle. For the ankle and foot. So for the right side, it's normal. The left side, there's a slight limitation also. The left side. So on the right side, it's all normal from the shoulder, elbow, hand, and hip, knees, and ankle and foot. But for the right side, in the shoulder, there is a considerable limitation related. One and then the other, the elbow, the hip, and the foot, the knee, they are all slight limitation related.
Extension ta ha. So, ako isa ka MTL, ako isa ka kuya na. So, muna ato ang action ng baton.
Okay, adjust lang. Okay, kapos ha. Sige, sa kapos ha. Meron yung makaya? Ah, easy. Ano lang, flat lang ka. Okay, see. Okay, on your own, sir. Ready? 1, 2, 3. Okay. See. So that was for hip extension. Is hip flexion. So, sir, imunti niya. Okay lang, ha? Tulak siya. Ready? 1, 2, 3. Morning last. Okay, that is for fun. See, same action, sir. Ready? 1, 2, 3. Okay. This is for knee hip extension. Knee hip extension. See, so okay, ha? Ready? 1, okay. Then knee. Morning, guys, sir. Okay, bye, bye. See, on your own, sir. Ready? 1, 2, 3. Okay, see. Next is hip abduction. Anak, ha? Anak. Sige, ready? Okay, spread the leg up. Spread. Okay, move ang legs like this, ha? Morning, guys, sir. Okay, so much. Sige. On your own, sige, ready? 1, 2, 3. Okay, sige. Karoon, take atong excluding words, ha? Sige, check ako. Ready? 1, 2, 3. Ayun, ganun. Ha? Sige. On your own, sir. Ready? 1, 2, 3. Okay, sige. Sige, episode, sir, ha? Ready? 1, 2, isa ka episode. Okay, sige. On your own. Ready? 1, 2, 3. Okay, sige, close. Ready? 1, 2, ay, ano? Okay, on your own, sir. Ready? 1, 2, 3. Okay. Sige, ako now yung tilt. I'm going to push it downwards, ha? Okay. So, next, arm. So, on your own, sir. Ready? 1, 2, 3. Okay, sige. Sige, I will do dorsiflexion for P-rounds. Ano ko? Right ako na. Okay. On your own, sir. Ready? 1, 2, 3. Saka to. Towards the ceiling. Okay. Next is inversion. Sige, ako this is for P-round. Sige, on your own, sir. Ready? 1, 2, 3. Okay. Sige, this is for inversion. Dos ako. Okay, on your own, sir. Ready? 1, 2, 3. Go. Okay.
Patient presents with significant decreased ROM in the left UE and LE secondary to spasticity and weakness respectively.
So next is for shoulder flexion. What to do is raise your arms toward the front. You want to go. Okay, very good. This is for shoulder flexion. Possible, even more arm. But raise your arms toward the ceiling. Ready? 1, 2, 3. Go. Okay. Next is I want to raise your arms toward the side. Ready? 1, 2, 3. Go. Okay. So this is for shoulder horizontal adduction. So I want you to do motion is okay. This one in move towards your chest. So whatever. Okay, for shoulder. First is for shoulder horizontal adduction. Okay. What I want to do is move your arms towards your right. Ready? 1, 2, 3. Go. Okay. Okay. I want you to raise your arm dito. Ready? 1, 2, 3. Go. Raise your arm dito. 1, 2, 3. Go. See, both flexors are going to do this. Bend your elbow. Okay. Ready? 1, 2, 3. Go. I want you to shake your elbow. Ready? 1, 2, 3. Go. Shake. Shake. Okay. This is for shoulder flexors. What I want you to do is to raise on your arms like this and I'll be taking 1, 2, 3. Ready? 1, 2, 3. Shake on the seat. Ready? 1, 2, 3. Go. Okay. Right shoulder extension. Sir, I want you to raise your arms towards the seat. I'll be putting standing like this. I want you to flip and out. Ready? 1, 2, 3. Go. Okay. Shoulder adductors. I want you to raise your arms towards the side. I'll be taking 1, 2, 3. Ready? 1, 2, 3. Go. 3, 3. Go. Okay. Shoulder horizontal adduction. Okay. I want you to move your arms inwards towards the left. Okay. I will be putting minimal distance. Ready? 1, 2, 3. Go. Okay. Shoulder internal rotation. Okay. I want you to do the opposite motion again. I will be putting minimal distance. Ready? 1, 2, 3. Go. Okay. Okay. Shoulder internal rotation. I want you to raise your forearms towards the ceiling. So after I'll be putting minimal distance. Ready? 1, 2, 3. Go. Ready? 1, 2, 3. Go. Okay. So for elbow flexors, I want you to bend your elbow and I'll be putting minimal distance. Ready? 1, 2, 3. Go. 3. Okay. So elbow extensors. Yeah, I'll be putting minimal distance. Straight elbows. Ready? 1, 2, 3. Go. 3. 3.
Okay, we will do muscle testing for your right hand first. I want you to place your palm down. Place your palm down. Alright. Now, palm up. And palm up. Okay. Go against my hand. Going up. Going down. Now towards the side. Go to the left. Alright. Okay. Push. Okay. Other side. Towards your left. Follow me. Okay. Up. Towards left. Towards right. And push around. And okay, ma'am, I want you to resist my hand. Move your leg towards the sky. Okay. Now, resist my hand. Move your leg towards my hand, okay? Resist my hand. Ready? Towards the right this time. Go. Okay, towards the left. Go, towards the left. Okay, very good. Now, try to extend. Try to move your leg going up. Okay. Resist my hand. Okay. Resist my other hand. This one. Up. Okay. Move your foot towards the right this time. Towards the right. Now towards the left. Again up. Okay, down. Down. Thank you. Now, for your left leg, try to raise it going up as far as you can. As far as you can. Okay. Now turn your leg going inside. Sit a while, your thigh going inside. Going inside. Go to the right this time. Okay. Now move your foot going up. Down. To the right. To the left. Okay. Okay, only to flip. Flip, flip, flip. Okay. This is my hand. Go up. Go low. Okay. This is my hand here. Try to bend your leg. Okay. Okay, so now your left leg this time. Go up. Your left leg. Okay. Down. Bend your leg. Okay. Down. Now make your foot go up. Down. Left. Right. Alright, thank you.
My name is Lynn. I'm going to measure the muscle group of your biceps, of your quadriceps, and your gastro. This muscle. And also, I'm going to measure the distance of your umbilicus, or your part here towards your. This is your LLT to know if there is some difference in your leg length. So we have a pictures for your umbilicus. Okay, so we start here. Okay. So this is 78, and now once we start here as 78, 74 was the measurement of the RRMS, and this is for the true length we have 78.4. Next, on the left side, we're measuring from here again. We start here for the leg length. Okay, length on the left side we have 73 because 1 RRM. Now for the true leg length we got 78 centimeters. We're going to do muscle group test. What I want you to do lang ma'am, every time na I say na panggahi na good guy, we are trying to determine the best measurement for your muscle group. So we measure here, here, and here. Okay, so let's start on this right side. Lang here. Do this. Okay, isa ma'am. Here, tata ma'am. Yung ma'am. What to do is panggahi. 1, 2, 3, go. Okay, so we got 50. Here, this is isa ma'am. Okay, ako to check ako na isipin panggahi naman. 1, 2, 3, go. Okay, we got 50.5. Next is down and catch up. We got 1, 2, 3, go. Okay, we got 50. On your side, we got the left side. 1, 2, 3, okay. Okay, we got 35.8. Down. Do only quadriceps. Okay, thank you. And we got 48.7. Okay. So next we got here gastro. 48.6. Okay. We got 26.6. So that was for the muscle group test. We've got the biggest difference on the biceps since there's 2.2 difference. On the quadriceps we've got 0.6 and on the gastro we have 0.4, which are not that a significant finding. This is because of the atrophy in disuse of the extremities. That's why there was some atrophy on the muscle group of the tested muscles. Come on sir, touch my finger kani using your right hand. Kana. Nabisod ka? Okay, so sir, di kasi makatuto sir, sige makatana. Okay, so nakikita ko disibation sa pagkuhan. Kanang index finger, pag-point sa akong finger. Next, ano yung try na to sir na kanang from delay to your nose. Okay sir? Nasa yung nose sir. Tika sir. Meron to? Sige. Okay, okay sir, ilong. Okay, so hindi mo mahuman sir. So dili ka sa tilas sir. Karon, palingkod sa mga lingkod ko. Karon, kanimong dako ng big toe sir, i-touch niya akong kamot. Okay? 1, 2, 3, go. Hindi ko rin sir ha? Sige sir? Sige, daw ka sir. Ikas na kuan. Okay, okay. Sige sir. Okay. So, listen to sir. So, akin na. Balik ko. May mabaton ka niyong kamot sir. Imayana. Magana ka. Okay. Together ko sir ha. 1, 2, 3, go. Ayan, doon sir. Okay. So, kung ito sir. Kanang try na to sir na. Akanin mo lang sa booking to sir ba? Marag yung isa ka imong heel. Together ka sir ha. Ano ba na? 1, 2, 3, go. Ano sir? Mga feet. Okay, marag ko English. Okay. So, i-try na to sir. Kaning imong feet. Mo siya i-slide mo sa imong feet. Ayan. Ana. Try na to sir. Sige daw sir. Sige sir. Kasi makayo mo sa pagkasa. Aning. Sige na sir. Okay, so with sitting down sir, namantayan ako na makaya rin mo siyang ting-ting without support. So this time sir, mag-weight shifting na to sir. Naman na natin. Oh, okay. Parang ko sir no? Sige. Okay sir, try na to na kuan. Kanay tabutan niya kung kamang sir. Okay, sir. Try ko sir. Pakita ko lang sir. Kung magpapalala sir, mag-weight kasi try ko ako sir. Oh, okay. Sir, try ko ako sa kasahan. Okay sir, try ka na mag-garong sir ha. Support yan mong kunin mo niya kung hulog ka ni ka, balik lang lingkod sir ha. Sige, try ka ako garong sir. Try ka man. 1, 2, 3, go. Okay, sige sir. Try ko ka ng kuan sir, kanang bali-bali sir. Kanang balik, diri ka left, right na mag-garong. Okay. Sige sir, balik ka. Sige, try ko kuan sir, kanang
So at this point, we'll be doing the balance and tolerance assessment. And for the balance, we'll be doing this in 3 different positions, ma'am. So while you are sitting, while you are standing, and while you are walking. So 2 tests, I'll be giving you different tasks. And while you are doing so, I will be timing, or I'll be measuring the time that you will be able to perform those tasks using a stopwatch that I have here. Do not hesitate to perform those tasks, ma'am, since I will be applying a gait belt so that if you'll feel unstable, I will have something to hold on to you. So do not be afraid, ma'am, to perform those tasks since I'll be ready to catch you if ever you will feel unstable. So, okay. So, okay ra, ma'am, dira kay siya guot. Okay, maka-breathe ra ka, ma'am. Okay. So, okay ra, ma'am, so let's start. Okay, so first, I'd like you to try to sit in a normal, comfortable position with your eyes open for 30 seconds. And now try to close your eyes for 30 seconds, then, ma'am. Okay, open your eyes na, ma'am. Thank you so much. Now, I'd like you to try to lean forward, ma'am. So this is weight shifting in all directions. Okay, now try to lean backward. And then say more right. and then sa imong left. Okay, so this will be done for 30 seconds each position. So patient presents with impaired static and dynamic sitting balance, graded F without support but cannot tolerate challenge and cannot maintain balance in weight shift. And for the tolerance, graded F, which lasts for 30 to 45 minutes. Sige, so proceed ta ma'am with standing, okay ra? So barug ta ma'am, so I want you to stand in a normal comfortable posture for 30 seconds. Okay, so next, I'd like you to stand with your feet together. Okay. For 30 seconds, gyapon. Okay. So next, balik lang ta ito yung comfortable na posture, ma'am. Okay? So while you're doing this, I'd like you to try to look at your left side first, still for 30 seconds, and now try to look the other side na pod, ma'am, still for 30 seconds. Patient presents with impaired static and dynamic standing balance, graded P, which requires support to maintain balance, with a tolerance of P, which is 15 to 30 minutes, secondary to compensatory posture from left-sided weakness and spasticity. So proceed na sa walking, ma'am. So for this, I'd like you to march in place. Okay, for 30 seconds. Okay, next, try to walk backwards, ma'am. Okay, we'll be doing this for 30 seconds, gyapon. Patient presents with impaired static and dynamic walking balance, same as to standing, and it was noted that patient tends to lean towards the right side during assessment. Okay, so next time we'll be doing a posture assessment. So this is to check if your body is properly aligned. So I'll be looking at two different views, same front view, same side view. So to make things easier, ma'am, I'd like you to just stand using your walker, ma'am, and then ako na lang mo try to look at your front view and your side view. Okay, so can you try to stand up, ma'am, using your walker? Okay, so I'll be looking at different areas or parts sa imong body. So we'll start with some head and neck, ma'am. Okay, so sa imong front view to start, ma'am. So do not feel, just feel relaxed, ma'am, and then shoulder. For the entire posterior view, left shoulder is elevated, left elbow is higher than the right, the ribs and breast are symmetrical, the left pelvis is higher, also the left hip, and then there is knee varus and left foot drop. So for the lateral view, there is noted forward-headedness, rounded shoulders, and protected scapula. There is increased lumbar lordosis, there is anterior pelvic tilt, and then there is left knee hyperextension and left foot drop. Patient presents with forward head, left shoulder elevation, lumbar lordosis, anterior pelvic tilt, left hip hiking, knee varus, left knee hyperextension, and foot drop, secondary to pain, weakness of left extremities, and instability.
So good afternoon, ma'am. We're in the next part of our examination. So the next thing we will be doing is to assess your walking, and basically we're going to observe how you're going to walk and in what ways are you walking. So this is to determine or see if there is any abnormal way or any slight lang deviations. Okay. So what we're going to do is stand dito and go to the open space, and we're going to observe you through a camera. We're going to record the way you walk. Okay. So first, I'm going to let you wear this gait belt. So with this gait belt, this is my way of trying to hold you and prevent you from falling or catching you when you start to fall. Okay. Okay, so let's stand up and go to an open space. So we're going to let you walk for 2, 4, 5 meters. So don't serve. Okay.
So with the gait belt on, you're now allowed to move the patient and observe the patient as she walks. Observe the reference limb from the side, from the back, and from the front using cameras or your eyes.
Okay, ma'am. So thank you very much for that. That was our gait assessment. So we'll review that later and we'll tell you the results of it. Okay? So thank you. So the next part of our examination, ma'am, is our walker assessment. So this is to assess the proper height of the walker that you're using so that we can so that you won't be having a difficulty in your walking or in the ways that you use your walker. Okay, so what we're going to do is, again, not a gait belt, okay, gait belt, to put in your waist so that I can hold you or I can prevent you from falling. And so we'll stand steadily in your walker and we'll measure you through a tape measure, and we'll try to adjust the walker that you're using for easy use next time. Okay?
So with the walker assessment, the appropriate height of a walker can be determined with the patient standing or supine. The hand grip of the walker should be placed level with the patient's wrist crease, ulnar styloid process, or greater trochanter, with walker positioned in front of and along the patient's side, with the patient's arm straight along the sides, and the feet of the walker should be resting on the floor or even with the heels. The hips and knees should be straight and shoes should be worn. A tape measure can be used to determine the distance from the patient's greater trochanter to the heel, with shoes on and with the hips and knees straight. So the value is used to adjust the height of the walker by measuring from the floor to the top of the handpiece, with the walker resting on its feet on the floor or a higher surface, such as a treatment table for convenience.
So that was it for our walker examination, ma'am. So with that, based on our results measurements, okay, the walker is in the right height and the right measurement so that it can accommodate your walking and your activities. Okay, so with that, we'll move on to the next examination. Okay, ma'am, so we're now ending in our examination. So in this next part, I will be asking you some questions, okay, regarding the affectations of this condition to you and how it affected your life, how it affected your activities of daily living. So in short, your functional activities at home or at work or anything other than that, okay? So, akong questions, you may answer if you're doing this activity with a helper or with no helper, and with that, I can say, or I can observe that you have complete independence or dependence in this activity. Is that alright? So with that, I'm gonna start with your self-care. Okay, so self-care, ma'am. When it comes to eating, do you usually have a helper or no helper? So there is a helper. Okay, there's a helper. So the next is grooming. Okay, so when you're trying to groom yourself, okay, nalagyan ko minimal. Okay, there's a helper, but moderate lang, moderate. So for bathing, same lang, moderate. Okay, there's an assist. Dressing, okay. Dressing, so for lower body, a helper. A helper, so I'm gonna grade it to you. Okay. So sa imong ma'am, sa imong bladder movement, okay, sa imong paglibang, CR, wala. Okay, wala. So independent siya. Okay, wala ka helper. Okay. So the next is transfers, ma'am. Nabalin mo from bed to chair or bed to your walker. Nara, may helper pero dili kayo siya. Gamay na siya, ma. Tama, okay. Minimal ryan helper. Okay. So transfers to your bedroom, to the sala, or living room, or the kitchen. Nari, usahay nari magsunod nimo. Okay. So sa stairs, ma'am. Nari stairs, okay. Nari sa mag-assist. Okay. So kani sila, no? Matabang na sila nimo, more or less tabang din sila nimo. Okay. Sa imong pag-storya, ma'am, nay na subject. Social interaction, wala na. Okay, modified. Sa problem solving, wala na. Okay. So, all in all, based on my interview, I can say, ma'am, you will need to have moderate assist in doing some tasks. So, meaning, there is someone with you to try to help you with your task. So, that will be all for the functional assessment. So, thank you so much.
Next thing we're going to do is the arm ergometer. This is to check your body's ability to take up oxygen. Here we have this arm ergometer, which looks like a bicycle. So I want you to pedal it as if you're riding a bicycle with your hands. 1, 2, 3, go. Doing that, miss, okay, I want you to rate what you did using this rating of perceived exertion. This is to rate how hard you think your body did. So the patient chose 13, which is somewhat hard. We're going to do the bird balance scale. This is to assess your ability to balance safely as well as to determine your risk of falls. So I will be asking you a series of tasks for you to do. For that, let's again put on your makeup for safety.
For numbers 1, 2, and 7 in the Berg balance scale, these are already performed based on the previous tests.
Next, I want you to sit with your arms folded for 2 minutes. I want you to please sit down. I want you to transfer from this chair to that chair. I want you to please close your eyes, stand for 10 seconds. Next, I want you to raise your arm to 90 degrees. Now, I want you to pick that shoe off the floor. Can you do that? I want you to turn and look directly behind you over toward the left shoulder. Yes, I want you to turn in a full circle starting with your left, and after doing that, I want you to turn again to your right, like this. Next, I want you to place each foot alternately on the step and then continue until each foot has touched the step stool 4 times. I want you to place your right foot in front of your left foot, okay? Next, I want you to lift your right leg up like this and try to pull it as long as you can. Okay? Next, miss, we're going to do the modified fatigue impact scale. This is to assess how fatigue affects your life. Here we have a list of statements that describes the effects of fatigue. Each statement, I want you to encircle one number that best indicates how often fatigue has affected you in this way. So during the past 4 weeks, please answer every question. If you're not sure which answer to select, please choose one answer that comes closest to describing you. So in case you don't know some words or phrases here, you can ask me, okay? So the patient has modified independence of fatigue secondary to central fatigue.
Proceed with the assessment. For the medical diagnosis, it is the relapsing remitting multiple sclerosis. PT impression would be neuromuscular pattern E, which is impaired motor function and sensory integrity associated with progressive disorders of the central nervous system. For the PT diagnosis, so patient presents with painful, burning, aching feeling on bilateral lower extremity radiating from legs to toes, spasticity, limitation of motion, muscle weakness, atrophy of muscles, decreased chest expansion, impaired sensation and coordination and posture. For the PT prognosis, patient has a good prognosis towards improvement in quality of life and is good candidate for PTR. For our problem list, first is with the impairment. So we have dysesthesia on bilateral lower extremity radiating from legs to toes, graded 8/10 on NPRS. The ICF code for that is B2804, which is radiating pain in segment or joint, which is its description. For the second one, it is the spasticity in the left upper extremity secondary to upper motor neuron lesion. So for the ICF code for that is B735, which is muscle tone function. The third one, it is the hypermobility on the left shoulder, elbow, wrist, hand, hip, knee, and ankle joints secondary to joint stiffness. The ICF code for that is B710 and S7201. For the B7101 is mobility of several joints, and then S7201 is joints of shoulder region. For the fourth one, it is the muscle weakness on left upper extremity and lower extremity secondary to atrophy and disuse. ICF code for that is B7302, which is power of muscles on one side of the body. For the fifth one, we had atrophy on left upper extremity and lower extremity secondary to muscle disuse owing to the spasticity and weakness respectively. ICF code we chose is S7708, so additional musculoskeletal structures. For the sixth one, limitation in motion on the left upper extremity and lower extremity secondary to spasticity and weakness respectively. The ICF code is B7101, which is mobility of several joints, S7201, which is joints of shoulder region, B7800, which is sensation of muscle stiffness.
The seventh one, we have decreased chest expansion secondary to trunk leaning to right side and compensatory posture. This has an ICF code of B4402, which is depth of respiration. Eighth is impaired sensation as a superficial, deep, and combined cortical sensations in bilateral upper extremity and lower extremity, which is the code of B270, which is sensory functions related to temperature and other stimuli. Ninth is impaired balance and tolerance as to static and dynamic sitting, standing, and walking secondary to compensatory posture from left-sided weakness and spasticity. This is the code of B2351, which is vestibular function of balance. 10th is impaired coordination as to equilibrium and non-equilibrium tests secondary to cerebellar dysfunction. This has the code of B760, which is control of voluntary movement functions. 11th is impaired posture, forward head, left shoulder elevation, lumbar lordosis, anterior pelvic tilt, left hip hiking, knee varus, left knee hyperextension and foot drop, secondary to pain, weakness of left lower extremity, and instability, which has the code of S7600, which is structure of the vertebral column. 12th and the last one, we have ataxic gait patterns with deviations in WA, SLS, and SLA, which has the code of B770, which is gait pattern functions. For participation restrictions, we only have one, which is difficulty in ADLs as to ambulation, transfers, upper extremity and lower extremity dressing, eating, and personal hygiene. This has the ICF code of D230, which is carrying out daily routine.
So now moving on to the ICF assessment sheet, we will be discussing the patient's perception and the healthcare's perspective. So for the patient's perception, here are the collected feelings of the patient. So we have here, I feel pain on both of my legs. I can't feel anything on my left side of the body. I can't feel anything on my left arm and leg. I can't bend my left leg well. I can't move my left arm and leg. I have muscle weakness in my left arm and leg. I have difficulty coordinating my movements. My arms and legs shake. I have difficulty maintaining my balance. I feel my muscle tightens on my left arms and leg. And for the activity, we have I drink beer occasionally but never hard liquors. I need help in eating. I have difficulty dressing my upper body and lower body. I need assistance when grooming myself. I have trouble bathing and toileting by myself, and I need help in moving from one place to another, and I need my glasses to read. For the participation aspect, the patient reports that I want to walk safely without the risk of falls. I want to improve my use of the walker to be able to do ADLs, and I want to go back to acting to provide for my son.
Now we will be talking about the health professional's perspective, which includes the ICF codes. First, the body functions and structures. B270 is sensory functions related to temperature and other stimuli. B2351 is vestibular function of balance. B2804 radiating pain in a segment or region. B7201 mobility of pelvis. B7202 mobility of carpal bones. B730 muscle power functions. B4402 depth of respiration. B4551 aerobic capacity. B51059 swallowing, that is unspecified. B7101 mobility of several joints. B7302 power of muscles on one side of the body. B735 muscle tone functions. B750 motor reflex functions. B7356 tone of all muscles of the body. B7402 endurance of all muscles of the body. B760 control of voluntary functions. B7600 control of simple voluntary movements. B7601 control of complex voluntary movements. B7602 coordination of voluntary movements. B7602 control of complex voluntary movements. B770 gait pattern functions. B7800 sensation of muscle stiffness. 67600 structure of the vertebral column, and 67708 additional musculoskeletal structure. Under activities, we have D2201 completing multiple tasks. D2301 managing daily routine. D2302 completing the daily routine. D450 walking. D4103 sitting. D4104 standing. D4106 shifting the body's center of gravity. D4153 maintaining a sitting position. D4154 maintaining a standing position. D4208 transferring oneself, that is
specified. D465 moving around using equipment. D5201 carrying for teeth. D540 dressing. D4358 moving objects with lower extremities that is specified. D4608 moving around in different locations, others specified. D5101 washing whole body. D5208 caring for body parts specified. D5308 toileting, others specified. D540 dressing. D550 eating, and D6504 maintaining assistive devices. For participation, we have D7102 acceptance or coping of disease, and D920 recreation of leisure. For the environmental factors and personal factors, we have the following. For environmental, E310 for immediate family. E325 for acquaintances, peers, colleagues, neighbors, and community members. E355 for health professionals. E410 individual attitudes of immediate family members. E5900 labor and employment services. For personal factors, the patient is a female 40-year-old actress who is divorced. We will be reporting about the categorical profile for this particular case. So for the categorical profile, our global goal is modified independence, lesser pain and movement, as well as acting. As you can see there from the colored boxes, those actually indicate the severity of the problem. That, as you can see from the table, it is in the orange box is until the fourth column, which indicates that there is a complete problem with the particular factors that are indicated there, with a goal value of 1, which means this is the severity that you're aiming for to achieve by the end of the session. Next is we have our service program goal, which is independence as to ADLs, particularly your ambulation, transfers, dressing, eating, as well as personal hygiene. To go back acting, with a severity of 3, when the goal value is 0. For the cycle goal 1, we have improved endurance with a severity of 3 and a goal value of 0. Cycle goal 2, which is improved mobility and strength in extremities, also with a severity of 3 and a goal value of 1. And lastly, we have the cycle goal 3, which is improved motivation, social and moral support, and emotional stability, also with a severity of 3, meaning severe problem, and a goal value of 0, indicating no problem. For the specific intervention targets, we have B270, which is sensory functions related to temperature and other stimuli. Its severity is 3, indicating severe problem. The goal relation is G, meaning this particular target is related to our global goal. With a goal value of 2, we have B2351, which is vestibular function of balance, with a severity of 3, goal relation is G, and a goal value of 2. Next is we have B2804, radiating pain in a segment or region, with a severity of 4. Goal relation is with the global goal and goal value of 2. We have B7201, which is mobility of the pelvis, with a severity of 2. It's related to our global goal, our service program goal, as well as the cycle goal 2, with a goal value of 2. Next is we have B7202, which is mobility of the carpal bone, severity of 2. Goal relation is with GSPC2, as well as goal value of 2. Next is we have B730, which is muscle power function, with a severity of 3. Goal relation is with GSP and C2, goal value of 2. We have B4402, depth of respiration, severity of 3. Goal relation is with GSP and C1, with a goal value of 1. And then we have B4551, which is aerobic capacity 2, and a goal relation of GSPC1 and a goal value of 1. Next is we have B5105 times, swallowing unspecified. The severity is 2. Goal relation is with G, goal value of 1. B7101, mobility of several joints, which gives a severity of 3. Goal relation of GSP and C2 and a goal value of 1. B7302, power of muscles on one side of the body, severity of 3. Goal relation of GSP, C1 and C2 as a goal value of 1. B735, muscle tone functions, severity of 3. Goal relation is GSP, C1 and C2 and a goal value of 1. B750, motor reflex functions, with a severity of 3 and a goal relation of G and SP. Goal value is also 1. B7356, tone of all muscles of the body, with a severity of 3. Goal relation of GSP, C2 as well as a goal value of 1. B7402, endurance of all muscles of the body, severity of 3, with a goal relation of GSP, C1 and C2, goal value of 2. B760, control of voluntary movement functions, severity of 2, goal relation of GSP, C1 and C2, goal value is 1. B7600, control of simple voluntary movements, severity of 2, goal relation of GSP, C1 and C2 and a goal value of 1. B7601, control of complex voluntary movements, severity of 2, goal relation of GSP, C1 and C2 and a goal value of 1. B7602, which is coordination of voluntary movements, severity of 3, goal relation is also GSP, C1 and C2 and a goal value of 1. B770, gait pattern functions, severity of 2, goal relation of GSP, C1 and C2 and a goal value of 1. B7800, sensation of muscle stiffness, severity of 2, a goal relation of GSP, C1 and C2 as well as a goal value of 1. S7600, structure of the vertebral column, the severity of 2, indicating moderate problem and a goal relation of GSP, C1 and C2 and a goal value of 1. S7708, additional musculoskeletal structure, the other indicating moderate problem and a goal relation of G, global goal, SP's service program goal, as well as cycle goal 1 and cycle goal 2 and a goal value of 1. D2201, completing multiple tasks with a severity of 2, goal relation of G, SC, C1 and C2 and a goal value of 1. D2301, managing daily routines, severity of 2, goal relation of G, SC, C1 and C2 and a goal value of 1. D2302, completing the daily routine, severity of 2, goal relation of G, SC, C1, C2 and goal value of 1. D450, walking, severity of 2, goal relation of G, SC, C1, C2 and a goal value of 1. D4103, sitting, severity of 2, goal relation of G, SC, C1, C2 and goal value of 1. Standing, D4104, severity of 2, goal relation of G, SC, C1, C2 and a goal value of 1. Shifting the body center of gravity, D4105, B41, severity of 0.6, severity of 2, correlation of GFP-C1, C2, and a goal value of 1. B4153, maintaining a sitting position, severity of 2, goal relation of GFP-C1 and C2, and a goal value of 1. B4154, maintaining a standing position, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B4208, transferring oneself, other specified, severity of 2, goal relation of GSP-C1, C2, goal value of 1. B465, moving around using equipment, severity of 2, goal relation of GSP-C1, C2, goal value of 1. B5201, caring for teeth, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B5040 for dressing with a severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B4358, moving object with lower extremities, other specified, with a severity of 2, and a goal relation of GSP-C1, C2, and a goal value of 1. B4608, moving around in different locations, other specified, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B5101, washing the whole body, severity of 2, goal relation of GSP-C1, C2, goal value of 1. B5208, caring for body parts, other specified, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B5308, toileting, specified, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B5440 for dressing, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B5550 for eating, severity of 2, goal relation of GSP-C1, C2, goal value of 1. Yeah. B6504 for maintaining assistive devices, severity of 2, goal relation of GSP-C1, C2, and a goal value of 1. B310 for immediate family, severity plus 1 sa facilitator, goal relation C3, goal value 1 plus. B325, acquaintances, peers, colleagues, neighbors, and community members, severity of 0, goal relation 3, goal value of 0. E355, health professionals, severity of 2 plus sa facilitator, walay goal relation 0 plus 2 ang iyang goal value. E410, individual attitudes of immediate family members, severity of 4 plus sa facilitator, goal relation of C3, goal value of 4 plus. E5900, labor and employment services with a severity of 1 sa barrier, goal relation of SP and G, and a goal value of 1. 40% is a positive influence, goal relation of C3, goal value of positive. Knowledge, positive gihapon, goal relation C3, goal value positive. Acceptance and coping of disease, influence is neutral, goal relation is G, SC, and C3, ngayang goal value positive gihapon.
Okay, so now we move on to the intervention table and evaluation display. So we first start off with body functions and structures. For our interventions, from B270 down to B735, except for B51059, physical therapists are able to perform the interventions. For dysphagia, we have to refer patients to a speech-language pathologist or their physician. So some of the interventions are as follows: desensitization, hydrotherapy, body balance training, therapeutic USD, strengthening, AROM, as well as PNF techniques and patterns. So for B270, OTs are also able to perform the intervention. For our goal value, we went with 2, but by the end value, we wanted to ensure that the values are either 1 or 0, meaning that either the patient is able to do it independently or they at least need just a little help or mild complaints. We also perform inhibitory techniques, Frankel's exercises, gait retraining, as well as postural awareness. So for this part, we wanted to ensure that the patient's tone, sensation, as well as control of movements are addressed. For the mentioned interventions, PTs are able to perform all of them with Frankel's exercises being assisted or performed by OTs as well. So for both our goal and end values, we decided to make them 1 since multiple sclerosis is a progressive condition. So we decided that we improve and maintain our patient's level of function instead of actually aiming for complete independence.
Next would be for activities and participations. It has been mentioned before that the codes have already been reported. So first would be transfer training, functional training, gait training, Frankel's exercises, gait training, balance and tolerance exercises, postural awareness training, transfer training, and assistive device training. So it could be done by physical therapist, and for OT can do Frankel's exercise, gait training, as well as assistive device training. So as what have been mentioned by Mr. Syed before, that the end value should aim at either 0 or 1. So it would be same activities and participation. So the interventions would be functional training, transfer training, and assistive device training. So the problems for activities and participation mostly focus on functional training. So it could be by physical therapists for functional training and by OT, and some functional training could also be assisted by the nurse, like toileting, dressing, and eating and washing the whole body as well. So again, end value would either be 1 or 0.
For the environmental factors and personal factors,
Here we have the immediate family. This is for the functional training. The other professionals again, these are the nurses, the PT and OTs, and then for the acquaintances with the peers, colleagues, neighbors, and community members. For the support group, this is by the physician, the OT, the psychologist, the social worker. Next is for the health professionals. This is for the support group comprises of the physician, OTs, and psychologists. For the individual attitudes of immediate family members, for moral support and family education, this is handled by the psychologist. Next is for the labor and employment services. For assistance and instruction, this is given by the physician and the social worker. For personal factors, support for the supportive person in return to function, this is all handled by the physician, nurse, PT, OT, and the psychologist as well as the social worker. For knowledge in teaching, support groups, webinars, consultations, and lectures, handled by the nurse, PT, OT, psychologist, and social worker. For acceptance and coping of disease, this is for support groups, also behavioral training and approaches. By the nurse, PT, OT, and psychologist and social workers. So that is all for our interventions and for our intervention table.
Okay, so next we have the evaluation display, so 6 weeks post-treatment. So during the 6th week of the PTR, service program goals were not yet evaluated. However, the patient was able to achieve her cycle goals of improved endurance, mobility and strength, and as well as motivation, social, and moral support.
Next slide, please. So all goals for problems related to body functions and structures were achieved, from the goal value of moderate problems with sensory functions related to temperature and other stimuli, vestibular function of balance, radiating pain in a segment or region, mobility of pelvis, mobility of carpal bones, and muscle power functions were all achieved to mild problems. For depth of respiration, it was achieved from mild problem to a no problem. For aerobic capacity and swallowing unspecified problems, it was achieved from mild problem to no problem. For problems with mobility of several joints or of muscles on one side of the body, muscle tone functions, motor reflex functions, and tone of all muscles of the body, the goal value and the end value was consistent, which is a mild problem. For endurance of all muscles of the body, it was achieved from moderate problem to mild problem. For control of voluntary movement functions, control of simple voluntary movements, control of complex voluntary movements, it was all achieved from mild problem for goal value to the same end value, which is also a mild problem. For coordination of voluntary movements, gait pattern function, sensation of muscle stiffness, structure of the vertebral column, and additional musculoskeletal structures, it was achieved from mild problem for goal value and the same end value, which is also a mild problem.
Next, we have the activities and participation. So all goals for the problems related to activities and participations of the patient were all achieved. So from moderate problem in completing multiple tasks, managing daily routine and completing the daily routine, to mild problem and moderate problem in walking, sitting, standing, shifting the body center of gravity, maintaining a sitting position, maintaining a standing position, transferring oneself, other specified, and moving around using equipment, to no problem. Next, we have moderate problem in caring for teeth, dressing, moving objects with lower extremities, other specified. They were all achieved to no problem. And then we have moderate problem in moving around in different locations, other specified, to mild problem, and moderate problem in washing whole body, caring for body parts, other specified, toileting, and other specified, dressing, eating, and maintaining assistive devices were all achieved to no problem. So basically, patient was able to achieve all her goals for her problems in activities and participations.
For environmental and personal factors, here we have immediate family, and then for acquaintances and peers, colleagues, neighbors, and community members, for support, and then for health professionals, also for support with individual activities of immediate family members, labor and employment services. For personal factors, that supportive person has a positive influence on the patient, and then the knowledge also has a positive influence, and lastly, the acceptance and coping of disease has a neutral influence. So that is all for the evaluation display of our interventions.